All right, welcome everybody. Thank you for coming along to the Dementia Knowledge Network for the month of May, which is a bit crazy. I'd like to begin by acknowledging the traditional owners of the land on which we meet today. I would also like to pay my respects to elders past and present. I will throw over to Sarah to introduce our guest speaker for today.
And I will just remind everyone this session is being recorded. We record these sessions and then we're able to upload them to YouTube. So if anyone doesn't want to be recorded, please turn your camera off. And I'd like to introduce our guest speaker, Dr. Susan Palmer, the founder of Gather My Crew, an Australian charity with a mission to build support and connection around people facing tough times, helping people to help people. So thanks so much for coming along, Susan. I'll hand over to you.
Thank you. And thank you for inviting me. It's always a pleasure. I love talking about what we do. And we're really interested to see how we can support people in the dementia space. So it's just a real pleasure to be here. I'm going to share my screen so I can take you through a little bit of a presentation. But I always say to people, I love a really casual presentation where just questions are thrown at me all the time and you can stop and we can go off on tangents. I'd really like us to make sure that you get what you need out of this presentation rather than me just going through the slides. So please feel free to interrupt. I'll also just, before I share, my background is a psychologist. I've been working in healthcare for a long time now. And this charity and our mission came out of, again and again, whether I was working in oncology or palliative care or disability, I'd see this common situation where people would be going through something challenging and they'd be needing help and support, and then be friends and family who kind of kept saying, let me know how I can help, or dropping off a lasagna or sending flowers or whatever it was, and it wasn't actually impactful, meaningful help. And so what we're trying to do is be that bridge between family, friends, community, neighbours who could be activated in a meaningful way and the person who's actually needing targeted support, and helping them identify what that help is and then communicate it to those people that are hopefully there and waiting for them. So that's our approach. I'm just going to share my screen very quickly. And I'm hoping just a couple of nods, just making sure that people can see that. Beautiful. All right. So our mission, our whole reason for being, is to build support and connection around people going through tough times. And of course, I'm here today talking with you all who work in the dementia space, but we work in, like I said, palliative care, oncology, disability. People use our tools and resources after bushfire or flood or any manner of situation where someone is going through something really challenging, and family and friends can provide meaningful help. We started with our app, and that is probably what we're most known for. We've been going for 6 years now. But what we realized over time is that to really help people build support and connection, an app's great, but for some people that's still a barrier. For some people, they still find it uncomfortable asking for help. They still don't know how to reach in and offer the right type of help. So we've also now got resources. We do education and training, and we're also trying to build up our resources on our website as well. I will just go back and say we have no barriers to people using our tools. So we provide everything for free. And we encourage as many people to download the app and use it and use our resources as possible. We are just about to hit 50,000 downloads of our app. That's 50,000 Australians who are out there helping each other through our technology. And over 300,000 hours of help has been coordinated over the time that we've been running. It's millions and millions and millions of dollars of replacement costs. Yes, I see a question. Sarah, is that you? Oh, thank you. Oh, it's a clap. Oh, thank you very much. And we really are, it really does come from just a place of trying to make a difference. So that's why we don't have any barriers. So it's free. This is based on oncology data, and I say this to give you a little bit of an understanding of why we exist and the problem. I have no doubt that the problem in the dementia space is as big or even bigger as what I'm going to talk about here. But this is oncology data. And what this data talks about is that while we have a great health system, when people go home and they're in their homes, up to 93% of their help and support needs remain unmet. So we've got this great health system, but then when people are in their home, they're not getting the help and support that they need. When I'm talking about help and support, I'm talking about, you know, things like help around the home, laundry, transport, someone to help you get your groceries, social connection, engagement, information, helping someone process and understand information, childcare and looking after young people, you know, all these kind of psychological support that might go on. So it's kind of like everything else except the medical support and care and that kind of like ancillary care that goes around that. And the reason it remains unmet is because if family and friends aren't doing it, it's just not getting done. So this is this idea that trying to encourage family and friends that if you're not doing this stuff, there are no, you know, ongoing services. No one's getting 10 hours of paid care in their house a day or 24 hours of paid care in their house a day. If you're not helping in meaningful ways, there are going to be gaps. And so how do we fill those gaps? And the reason a lot of the time this exists is because the people who are going through something really challenging, whether you're a carer of someone living with dementia or, you know, there's something else going on, it's so overwhelming. And so to know what help you actually need is actually, it's a real challenge to know what it is, because also you're overwhelmed. There's so much you need. You don't quite know what to say or when you need it, and needs change as well. So knowing what you need is a real barrier for people getting the help they need. Then there's also the barriers of asking for help. And people are very, very uncomfortable asking for help generally in Australia. There are barriers there in terms of, you know, oh, do they really want to help? You know, are they really busy? Are they going to see me as needy? Are they going to think that I'm not coping? Should I be able to do this all on my own anyway? And then there's offering help. Then there's the people on the other side who, when they're offering help, they don't know how to do it very well. So am I imposing? They'd ask if they needed it. You know, I don't want to seem like I think they're not coping. And so we've got this gap between people needing and wanting help, and then their family and friends who want to help them. And there's lots of barriers for making that happen, just that happen in our own head. But then even if you didn't have those barriers and you're ready to start coordinating help, I imagine if you're living at home with someone who has got dementia and that, you know, you're trying to support them at home, it's not a short journey, it's a long journey. And the type of help you need over months and months and years it just can't be coordinated without kind of like a specific tool that's been created for this. So I know that people have spreadsheets and people do things on WhatsApp and all those kind of things. But if you're coordinating a group of 15 people to do 30 tasks a week for 3 years, you know, that is something that needs, you know, a specific piece of technology to make it happen. I tried to do this for a friend for 6 weeks with a Google Doc, and it was the most disastrous thing ever, which is actually why this kind of has come about. It was like that combination of personal experience trying to do what I'd been telling everyone to do as a clinician all these years and realizing that actually it's impossible. I'd been suggesting something that was just too overwhelming. So what we're trying to do is harness, kind of like they're untapped because they don't always know what to do and when to do it and how to do it. Untapped resource of family and friends, and building support crews around every person aging at home so that those people who are around them who want to help can provide the right help at the right time when it's needed. So our app is used to like really easily organise transport, organise meals, help with kids, social visits, grocery shopping. When I did some research with cancer patients, one of the things that they kept getting was lasagnas, and one of the things that they really needed was bed sheets, changing of bed sheets, and someone coming in and helping them with that. So what we're also saying is it's turning those lasagnas into the help that's really needed, so you're actually having an impact, which is a win-win for everybody because the person gets what they need and the person doing the helping feels like they're doing something really valuable. Since I do the focus groups with those cancer patients, the first thing I offer now when someone is going through treatment, if I know them well enough, is, can I come and change your bed sheets? And sometimes people say no. A lot of time they are shocked to be asked, and they are so grateful because sometimes these things are physically impossible. So you just sleep in dirty sheets throughout your whole treatment. Yes, so I see a question there, Rachel. You're just on mute there.
Sorry, it's a very bad day. I just want to know, like, how getting the consent for the person that's going through it, like that they're willing to allow people to come and help them, because I think that's one of the big barriers we have. You'll have speak to carers especially, and the friends will offer, but they'll say, "Oh no, I don't want to ask them because they're too busy, or they're too, like, I don't want to impose." So how do you get through across that barrier, I suppose?
So generally 80% of our support crews are set up by the carer, who I imagine is the family member, or the person, rather than the person in need. So sometimes we have people who are setting this up. I don't imagine in your space they're setting it up when they're living with dementia, or maybe they are, I don't know. But it's generally the carer closest to them, or their child, the next level down. In terms of consent, we always say, make sure that the person here knows what you're doing. But because it is coordinating family and friends, it's the similar level of consent that you would need to make an Excel spreadsheet of all those people that had offered to help, or pick up a phone call and ask them to help you. It's about being ethically mindful what's appropriate, rather than legally requiring consent in that situation. So it's kind of like we're the facilitator, the tool, the same way, picking up the phone is a facilitator or a tool, or having a conversation is a facilitator and a tool. And because it's your own family and friends, you control who does what and sees what and is engaged in what. And it's interesting. I wonder in this space whether actually the person in need is the carer rather than the
Yeah, absolutely. Oh, well, I should say absolutely. I would say that a lot of the time it is the carer.
Yeah. And I imagine my hope of how we can help in this space is to ease the burden on the carers, spread the caring load across more people, and hopefully enable them to care for longer, if that's in fact what they want to do. And I'll show you some of our data towards the end of the presentation, which definitely shows if you get the app up and running, it reduces the burden on the primary carer.
I think too, it would be good for people living with dementia. Living alone could be very beneficial for those people as well, because they're not then having to organise it themselves. So, yeah.
And we do have people, and I've got an example further down there as well, where a daughter lived in Sydney and her mum needed support in ACT, and she set it up and ran it all from a completely different state for her. So we've got examples over the years of people who have used it in many different ways. So what we're trying to do is basically the key features of what we do is build the support crew. You're not saying support's not there, but we build them into a crew so they feel like they're working together to get stuff done. Build the support crew. You help identify the help that's needed, and then you coordinate that for them. And because you make it really super simple and easy to do, it can last a long time. We've had support crews that have been going for over 2 years. They're a group of young siblings keeping mum and dad aging at home, and they've managed to keep it going for over 2 years. I'm going to just take you through the screen so you can see what it looks like, and take you through, I guess, what the process would be for someone who wanted to use it. It is available now in Google Play and App Store. So you could do this right now, just download Gather My Crew and, have a look at it. But it's super easy to search and download. Oh, I don't know how. Ignore that. That'll come back again. And then what happens is you can invite your family and friends, and it's a digital invite. So I've had stories of people who, needed help getting somewhere in terms of transport. And this, again, we've had a lot of use in the cancer space. So often my case studies are cancer, but she needed to get to treatment on a Thursday at 2:00. And she asked one person, like calling them and asking them, can you please take me to treatment at 2:00? And they said, no, I can't, I'm not available. I love you, I can't. She said the second person, same thing. She knows they love her. I love you, I can't. Third, fourth, fifth, 5 rejections, as she would call it. She knew that if they could, they would, but it still felt very, very challenging and like a rejection, and she felt terrible. Then she got an Uber and got herself to treatment. So from that, she said she was never going to ask again because it made her feel so bad. She'd just rather get in Ubers and just manage getting to and from treatment by herself. She found Gather My Crew. It was recommended by one of her nurses. She downloaded it, and for the rest of her treatment, she never had to ask anyone again because she put in what her treatment times were. She had 15 people supporting her, and they just accepted the times that they could do, and she never, ever had to ask again. So she calls that, the idea of being able to invite people only once, and then they can see what needs to be done and it all runs itself in the background, is hugely beneficial to your mental health when you're going through something like this. So we make it really easy to ask for help by doing these digital invites where you can two options. You can either send an SMS to trusted people straight out of your contacts. So you click on all the contacts you want to invite and they get an SMS that cannot be shared if you want to keep it super duper private. Or you can create a link that you can then put on an email or a WhatsApp group if you want to ask people more broadly for help. So we've got these two ways. Neither of them require a conversation. And from that, people have said that's so much easier than asking for help. So this is, again, what it looks like. And you can see on the right of your screen, you've got these two options. When you click network and then that square there, you click on that square and then you get these two options: invite by SMS, click, off it goes; share the invite, off it goes. When those people accept those, they just come and you'll see them. You can see Susan and Chris and Katie are all sitting in, I'm pointing at it, that's not very helpful. On the left-hand side, you can see Susan and Chris and Katie who are sitting in that person's network. We've all accepted an invite and then we start popping up as part of their support crew and you can see who's in that support crew. Really importantly, I don't know if I say it here or later, you choose the role that these people play within your support network. So this has been set up so you can have multiple admins. And that means maybe there is a primary carer that wants to admin it, but they also want one of their children there as well, or their best friend, so that they can share those duties and people can go on a holiday and the world not fall apart. Or you can just have a break if you feel like you're burning out a little bit. The network support crew can still keep running. You can also have your inner circle where you identify those people who are very, very close to you and they can get different information. They get asked different tasks, and that not everybody is getting seen, has visibility of the same things that are going on in the app. We can stratify everything in there based on the role that you give them, or they could just be a general helper. So the people who you have helping mow the lawns or taking the bins out or dropping off a meal might be very different to the people who might need to come and give the carer a rest, act as some respite, or take someone, in terms of transport, or engage with someone in your house, and you can choose who those people are through the app. The other thing the app does is, initially I was talking about, knowing what help to ask for is really hard. So we've tried to support people by making sure we do this personalized screening of the help that's required. We ask a series of questions that then prompt this kind of like needs list that you can choose from to put into your roster. This serves a couple of things. It really normalizes help seeking. So this is all based on the data that we have. We've got the biggest database of informal care that's happening in people's homes in Australia. We've got 50,000 people who have been doing lots of caring, and we know what's actually going on for specific types of situations. That said, we don't have a big dementia cohort, which is what we're really be interested to look at. But from looking at what people need, you answer these questions and we can say, well, people just like you have needed this type of help when going through this situation. So you don't just get a whole lot of lasagnas. You do get that changing the bed sheets, and you do get that opportunity to ask for transport, or just one of the most popular things is bread and milk being dropped off at your front door. So you've always got something for your morning cuppa and a piece of toast. Little things like that can make a huge difference. And that's what this kind of like personalized screening does, so that everybody just doesn't get in there and ask for meals. This is what it looks like. So, what is it that's bringing you here? What's the situation? Who is it? How old is the person? There's other questions that are kind of like, do you have a dog? Do you have regular appointments? Are there dependents at home? And from this, we identify what that help list would be. And these are the things that we, encourage you to put into your roster. Once you've done that, you then create this help roster, which is just putting in all of the things that you might need help coming up, you know, in the future. We really encourage people, if possible, finding out about us as early on in the journey as they can, and then just putting in some really simple tasks that are not too big or burdensome, so that they get used to using the technology and this idea that there are people to support them on the journey before things really get super challenging, as they will over time. So they get really used to using the app and asking for help in the app. So initially you might only have 5 people that are part of your support network, and just every Saturday afternoon you just ask for a couple of hours to go and have a cup of tea and sit in a coffee shop by yourself and have a little rest. And that could be all you do for the first 3 months. But then over time, you might think, oh, you know, it'd be really nice to have someone help with that, or it'd be really nice to have someone help with that. And you've experienced the benefit of having a support crew and being able to ask. Like I said earlier, you can choose here who sees these tasks that you put in. The other thing that's really powerful here, and users have told us what they wanted. So we didn't have appointments and things entered in here until people asked for it. So when you click on that blue button, it actually comes up as you can put a task in, or you can just put an appointment. Appointments are about just keeping the family up to date about what's going on when things are coming up, so that there's not a breakdown in communication or a disconnect, or they know this, but they don't know this. You're kind of keeping everyone in the loop. And people find that really helpful. Again, some people just use that. They don't ever use the helping tasks, but they start by keeping everyone in the loop, and then over time they might get more comfortable adding some help. This is what those screens look like, just to give you an idea. I always talk about this in terms of I've got young kids and I'm always driving around in the car. I will pick that take the kids to school option every single time over dropping off dinner, because I hate cooking, but I'm always driving. So what this also does is it gives people, they can look at it and choose the things that they actually want to help with when they can help. And by doing it like that, the average support crew that we've got going is anywhere between about 5 to 8 months. This is not aged care, but 5 to 8 months, because we make it really, really easy for them to help. Because you look and you choose the ones you want to do, and you make sure that you can do it. It goes into a diary, super duper easy. So you take that kind of like first flurry of people offering support, and then you turn it into something that just goes on and on and on and on and on. We also have a place where an inbox where you can put information about what's happening and have this kind of like single source of truth. People put updates here, they chat to each other and they upload photos, they keep relevant information like scripts. Digital scripts are fabulous for putting in here, because it means if you do need something, you just put a note out to your support crew and say, I'm nearly out of something, can someone run past a pharmacy? And you can just show that digital script and get what it is you needed and get it dropped off. So it's just making things so much easier. Even things like favorite recipes can go in here. The powerful part of this, and the reason we've built this, again, this is based on user feedback, is that we've done it in folders. So some people say, well, I already got a WhatsApp group. But for anyone who's done a WhatsApp group, and I've got like a WhatsApp group for my children's soccer clubs and all sorts of things, you are scrolling and scrolling. And when am I bringing oranges? I don't know when I'm bringing oranges. I'm scrolling for days trying to find that thing that said when I was bringing oranges. And it's just it can become so onerous and unhelpful. What we have here is you put the content in folders. So there might be a folder that says orange roster, and I can click straight into it and find out when I'm bringing those damn oranges. Whereas, you know, this is the benefit of using something that has been created by users for this specific experience. Another reason why it's better than a WhatsApp group, as our users tell us, is that it keeps the conversations and all the stuff that's about, you know, mum and dementia and everything that's going on with mum quarantined from other platforms. And the reason people tell us that they like this is because what they're going through and all this information and content about mum is really upsetting. And when they are just having a moment, maybe they're just having a little rest where they're not thinking about it, they just don't want to be bombarded by someone saying, hey, how was mum today? Or how did that appointment go? Or how are things going? Because it just eats into that moment that they might have had when they had a little bit of respite from it. So people like to be able to, you get notifications and pop up when content is posted to this, but you then choose to go into it when you're ready to look at it, when you're ready to engage with it, rather than it kind of coming in sideways when you're not ready. So again, we have some people that just use it just for this communication, and they say to everyone, please only communicate on the app so that then I can control it. The other thing with this is only admins can initiate the folders, which means you don't get a ream of people saying, tell me what's happening, what's happening, what's happening, what's happening, what's happening, what's happening. It can only be initiated by the person who's created the account. And that's what it looks like. Again, just a little bit of data from us. This is average. It's kind of, our data is a bit all over the place because, like I said, what's happening for someone who's gone in for a knee operation and they need 2 weeks of support is not the same as a family looking after mum and dad as 2.5 years of support. So I've got 4 months there. It's not really, it's a bit longer than that. If we take out those small surgeries, it's about 15 people, but it's kind of like 12 to 15. If every one of those people on average do 1 task a fortnight, so it's not heaps of help that people are doing. 1 task a fortnight is completely doable. And we average that out to be about 2 hours. That's 60 hours of extra help a month that people are getting from family and friends. And this is, our whole point is that we're not magically creating people who aren't already there. But when people know that these support crews exist, neighbours come in and might just do the bins. And that's just 1 task a week, takes hardly any time, and it's 1 extra thing off your list of things to do. Or someone might come and walk the dog. Someone just drops off bread and milk a couple of times a week. They're really small tasks, but it adds up to be really meaningful help. These are our most common help provided. They're not in order. I don't know why I put them in that order. If they were in order, it would be social connection first, then meals, then transport, then kids, then home help. We're really proud of this because a lot of times people do just do meals, and we've been going out there talking again and again about help is more than just meals. There's so much more to supporting someone than just meals. And we really love that social connection and support is our number 1, because that's really what we push a lot. And this is our impact. We do user surveys every 4 months or so. This is our most recent one. And this is what I'm talking about in terms of burden on carers. We have only used strongly agree and agree data. We haven't used any neutral data. If we had neutral data in this, it would be 100%. So no one is saying that things are worse with using the app. So 95% of people who get a support crew up and running say reduce the burden on the carers. It makes it easy to ask for help. It makes it easy to coordinate that help. It reduces social isolation during the experience. The interesting thing about this is that people report that even as they just get the app up and running and they never ask for help, which I find really interesting. It's this idea of knowing that there are people there and following your journey, and you could ask if you needed it, and maybe you'll send an update every now and then. But just knowing they're there reduces the sense of isolation. And then you've got increased connection and community. So this sense that you feel closer to your community. I'm going to now go on to a little bit of case studies. Does anyone have any questions at this point?
Yeah, sorry, Susan. This might sound like a silly question, but with the support network that you're building in your group, is it predominantly just family and friends, or is there actually like complete volunteers who say they can help with a certain area?
We don't use volunteers. We don't use or place volunteers.
Okay, so this is strictly family and friends.
So we promoted Gather My Crew as just family, friends, neighbours, community. That's kind of how colleagues, that's how we talk about it. However, because we don't put any barriers to who's using it, we do have faith groups, Rotary clubs, Probus, organisations who choose to use Gather My Crew to coordinate their own volunteers to look after vulnerable people in their community. So it is being used for volunteering. We do not provide volunteers.
Okay. Thank you.
So this is just to, I guess, help paint a bit more of a picture. this is probably our most dramatic story. I'm not suggesting everyone's like this, but Kat was diagnosed with serious cancer, breast cancer at the age of 40, and she had a 1-year-old and a 3-year-old. It was in December, so there was no childcare available to her. She's a single mum, and she refused treatment because she couldn't get her head around how she would coordinate all of the help that she could possibly need to go in and have surgery and be in hospital for 7 days, and who was going to look after her children. She couldn't get there until her breast care nurse sat down with her and got her engaged in Gather My Crew. She built a massive support crew, and friends moved into her house and looked after her kids and made it all happen through the app. And she worked on with the app for about 8 months and is now cancer free. But she says the app saved her life. And so that's completely hyperbole. I don't think it saved her life. But what it did do was make it easy for her to bring those people together that enabled her to have the treatment that saved her life. And without it, she couldn't imagine how she was going to do it. So that's Kat. She actually, what lovely thing about Kat as well is she started this thing where every Saturday morning, someone would come over to look after the kids. This is when she was back out of hospital. Someone would come over to look after the kids, and then someone would just be with Kat where she just did a wellness morning. And she got to choose, it's basically respite every Saturday morning, just something she wanted to do that would fill her bucket. So she went for walks, and she went for movies, and she went for massages and facials, and she just did something really lovely. But they rostered that in to make sure that she was always looking after herself. And I really love that, because now I talk about that a lot, but I didn't even think about that until Kat started doing it. Merrin is the person who was in ACT. She had a car accident. She was in ACT and needed support while her daughter was in Sydney, and her daughter ran her support group for Merrin's friends. So once she got it all up and running, she got all Merrin's friends' contact details. They looked after her, but her daughter ran it all for her. And Lisa is who I keep referring to in terms of it's been going on for over 2 years. She was the main carer of her parents for 5 years, and was like, I don't know if she was thoroughly burnt out, but she was so close to burnout, and the conversations had started about mum and dad need to go into care because I can't manage anymore. She used the app to bring together her 4 siblings who, interestingly, had all lived in the same kind of area but hadn't been helping for 5 years. She brought them all together, and they could then, once she put all the information in the app, they could see how much she had been doing. So even though she'd been saying to them, I'm burning out, I'm doing so much, they were kind of like, yeah, I'll drop in and see mum and dad on Sunday, because they hadn't realized the extent of what she was doing. But the transparency of the roster in the app makes it really clear how much single people are doing. And so they're still going now. They share it just amongst the 5 of them really nicely. And, she's now able to live her life as well as being able to care for mum and dad at home. So that's just a few examples of how, I guess the app has worked in the wild for people needing to coordinate support. These are our most common questions. We are funded by philanthropy. We are a registered charity. Everything's free. We do not sell the user data. We do not promote any advertising on the app. We truly exist only to build support and connection and help people to help people. That's kind of it. We have a range of posters and flyers that if you would like us to send out to you, we'd love for you to have, to put up and to share and to promote if you think it would be helpful for your consumers. And I'm always, you might be able to tell, I do this talk a lot, and I love talking about it, and I'm available to talk to anyone else if you would like to get in touch and get me to come and talk to people. We'd love to do that. And that's it. That's Gather My Crew. And I'll stop sharing.
Thank you so much, Susan. That's an amazing amount of users that have gone through it. And listening to you saying that it's easier to ask through an app rather than just ringing someone and asking, I wonder if that's got something to do with the whole, nobody likes to ring anyone anymore. It's just easier to email, text, put something in an app. Do you think that has something to do with it?
Maybe, but I also think it's about the rejection is gentler.
Yeah.
Where you've got a group of people who are kind of anonymous. They're not really anonymous, but you've got a group of people on an app than calling someone or asking them face to face. It was more, our feedback is more the brutality of the rejection. Even when you know they're not rejecting you, stops people from asking. So it could be, I mean, I'm sure it is a little bit of that. I know that my children never phone anyone ever. But yeah, I think it's also about, you know, that awkwardness, reducing the awkwardness.
Yeah. Did anyone else have questions for Susan?
Susan, I had a question around, I guess, how people can become aware of the app and its uses. And I think you gave the example with, was it Kat, who there was a social worker or somebody at the hospital who I think got her on Twitter, or one of the oncology nurses. Is that a common referral point for people, like when they are discharged from hospital or post-diagnosis, or in an environment where, you know, their life has been turned upside down and they're all of a sudden overwhelmed and needing support?
So yes, I mean, ideally, we know that the people who are most likely to go on and use the app hear about it from a trusted source.
Mm-hmm.
So part of our process in terms of marketing, promotions, awareness is referral partners. As much as we can, those people are in the closest contact with the person and the carer going through something. That's always a challenge, trying to get into the right people at the right time. But as earlier on in the journey that people find out about this, the better. So we do that approach. We then also community support organisations, which is, you know, they've been discharged or whatever, and now they're floating around the community still needing so much help. And that's where community support really steps up and comes in. But then also word of mouth. So we always talk about, it takes 3, when you're building something, a new brand like Gather My Crew, to build trust, you really kind of need to hear about it 3 times. So we kind of go to, yes, the trusted professional, then the community support, and then hopefully their best friend mentions it as well. And that's kind of like the holy grail that we're trying to get to. But we love referral partners. So we go strongly into predominantly social work and nursing as best we can, and really get people aware of it and talking about it, and trying to find champions in each space that can promote it because they know the value.
That's great. Thank you. That makes sense. Did anyone else have any questions or comments?
Yeah, hi, Wendy from Homestead. Susan, just wanted to ask, does it always have to be in response to an invitation? If you're an admin person and you spontaneously do a drop-in, can you then add that to the schedule and everyone can see that at 4 o'clock today Wendy was there? Or does it have to be, 1, do I have to be an admin person to do that? And 2, can anyone who's on the participation, can they add to the calendar in that way?
So only admins can enter information into the app, and that's intentional, so it doesn't get too crazy and chaotic.
Yeah.
But you can have as many admins as you want.
Right.
So the app's been built to be as flexible as possible based on the different types of ways people choose to use it. You can't enter things in after it's occurred. But you could say, I'm on my way there now. I'm on my way to see Wendy. I'm just going to pop it in there so people know that I've been. You can absolutely work it like that, but you can't retrospectively put things in.
And could you potentially put it in the chat function? You know how you said that there was that chat feature. You might be able to, would that be, you could just put things in retrospect from that chat.
Yeah, yeah.
And also I just want to say thank you, Susan. I think I actually was using this app 3 or 4 years ago when some random person said, hey, remember that person? They now have cancer, and would you like to go on a meals drop? And so I think I was using the app 3 or 4 years ago, and it was, it was really good, and it made me, even though I barely knew the person, I was really willing to help. And I think people do want to help. They just don't, I would never have probably had the opportunity to unless there was an app, you know, because the connection was so fragile, like so weak in a way. Does that make sense?
Yeah, we love hearing that because it really does expand your network by doing it like that. And you would have used our web-based app. we are now a fully native app, and I'd love for you to have a play around with it now. It's so much more fabulous and powerful than it was a few years ago. But I love that you've used it.
Susan, would it be likely that a family caring for somebody living with dementia, for example, might put, I'm kind of going back to Wendy's question, might put their care coordinator or someone on it?
So yes, you can also do that. So people use it. So we actually have people who are using it to coordinate their paid care, and to manage their own care packages and things like that. So because you can have an inner circle and then everybody else, you can actually include other coordinators and paid care in there as well. If you choose to. It's been set up that it can do that, but that's completely up to people's choices as well.
And I guess for a case manager, they could potentially be in having to look at sort of 50 different versions of the app or something for 50 different people.
So now it's moving more into, so we've been talking, Sarah, about Gather Group, so Gather My Crew is the charity, and we actually now have a social enterprise which funds the charity for people who do want to purchase versions of it, where you could have a version of the app where you had a dashboard and you could see everything of all of your clients if you're a case manager. So you'd use it a little bit differently, and that would be the subscription version of it, which gets a bit confusing. So just for people, just a little bit of background, Gather My Crew is trying to be self-sustaining because we don't want to keep going out and asking for philanthropy. We know that people value what the app is, and so now we have a social enterprise where people can actually purchase their own branded version of the app and promote that, and then capture all that data and then support their own consumers through that. So there's now kind of like two versions. But we're talking about completely free already.
Yep.
So sorry, another question. It's so confusing because both myself, I'm a Wendy, and she is Wendy, so we're Wendy and Wendy from home, like Home Instead. So just trying to go back on the sort of the corporate side of the app, would you say that it would be used as a CRM function, or are you saying that it would be a communication sort of like, instead of having like a communication book at the client's home, this is the type of a communication sort of online communication tool for family and friends that are part of that client support crew?
So it's both, because I guess what I haven't talked about is what the features of the branded option is, but it has additional features where you're actually pushing information based on the needs of the client straight into the app. So their family and friends, if you go through those series of questions and they are someone living with dementia alone, you can push specific information to their family and friends about what's going on for them. If they're early stage, you can push information about early stage information and education. If they're later stage, so you customize the content in terms of CRM, like managing information and education straight through the app. But then you can also use it, that inbox function about sharing information. It actually also has a check-in function, so each week you can check in how they're going and then lean into them as a case manager to support them, or maybe they're going okay. So that version has additional features, and I'm happy to, it's me too, I just put on a different hat and have a chat to you. So if you do want to have a conversation, I'm more than happy to do that. I actually am really thinking Wendy Miles is a familiar name for me, and I may have come out and seen you.
You did when we were in Upway. We've moved to Fenton Valley. So yes, I think we had one care manager. So I wanted to introduce Wendy today. She's our new team leader with Nicola, because we've got 15 care managers. We've got another new one starting shortly. So yeah, we're So
I thought that was the same name.
I've been off for 2 years with cancer. So my girlfriend from overseas, so this is one question, but I didn't want to get sidetracked, but she's wanted to set it up for me, and she did, but we ran into difficulty with an overseas person. I can't remember the details because I chemo and everything going on, but
I can answer that one for you as well. Gather My Crew is Australia only. So
Okay,
because
that
we're
was
funded
cool.
by philanthropy, we
Yes.
can't support the world.
Okay.
The paid version,
Yeah.
it can be open to across places.
Okay, I see.
So that's the difference. So yeah, we often have that people do want to create a support crew with someone who lives overseas, and Gather My Crew just can't do it because once you've got it in the App Store, it's open to everybody.
Yeah.
And we can't support that.
Okay. Thank you for clarifying. Yeah.
Thank you.
We
Okay.
might actually invite you back later this year, perhaps to talk about the other version.
Oh, I'd love to.
Okay,
Love to.
if people were interested. Were there any other questions about the free version? No. Yes,
Sorry.
Wendy's.
I'm actually going to try it, Suzanne. My dad's 90 and we're going in 3 times a day and it's driving me crazy. I don't know when my siblings have gone in. We've got a text group. Anyway, I'm going to give it another
Yes,
go.
that
Yeah.
sounds fabulous. And one of the things when we did research, we actually did some research in aged care. I can't remember, I've had the conversation a few times today, but I don't think I said this to you guys. When we did some research in aged care, one of the number one thing that I was talking to clients that they wanted, they didn't necessarily want to use the app. I don't think your dad wants to use the app. But one of the things they did say was what they would really love is to change that Sunday once a month when everyone turns up and it's really loud and they never really get a chance to chat to anyone. If everyone could just turn up once or twice during the month alone, they wouldn't be sitting on their own for 30 days and then inundated by all this noise one day a month. They'd have this kind of like considered check-in throughout the whole month, and it's no extra effort on the people. It's just changing how they think about it. So that's definitely how, you know, we really see the app using in aged care as well, really kind of like stretching out that support in different ways.
Well, that's been fantastic, really, really informational. And I know you and I have had some chats, Susan, and we're going to meet again whenever it is, Friday.
On Friday, I'm coming to you.
Brilliant. I look forward to that. If there's no other questions, we'll close the meeting. Thank you, everyone. I do apologise for videos not going up. Hopefully I'll get all those done for this year, this afternoon. And again, thank you hugely, Susan, for coming along and chatting to us this afternoon. Really appreciate it.
Thank you so much for having me. If anyone wants any collateral flyers, let me know. I'd love to send you some.
Thank you.
Thank you.
Thanks,
Thank
guys.
you.
Bye-bye.
Bye.
Thank you.